Good morning, and thank you for joining us today in our next series of our fourth quarter webinar updates. Today, we will be joined by Anthem Kentucky for a review of their 2026 product updates. During the session, your lines will be muted. However, should you have questions, please enter those into the question box and we will address those at the end of the segment. My name is Tracy McGee Lawson. I am a Senior Account Manager with Cornerstone, sitting in our Cincinnati office. If you don't already, please follow us on social media or subscribe to our weekly Monday Minute for the latest Cornerstone carrier and industry updates. And with that, I am going to turn the presentation over to Kathy Huntsman and Lisa Wilson with Anthem Kentucky. Thank you.
Thank you, Tracy. Good morning, everyone. My name is Kathy Huntsman. I am a Anthem of Kentucky small group and individual account executive. And I'm going to go on and let Lisa introduce herself, and then we'll get started with our presentation. Lisa?
And good morning, everyone. I'm Lisa Wilson, and I am your account manager for group sizes 2 to 50 for small group. I've been with Anthem for 26 years, and I work with all of your existing business. And I'll turn it back over to Kathy.
Thank you. Okay. Lisa, can you see the presentation?
Not yet.
Okay, let me go back. Sorry. Share. Can you see it now?
Looks like it's trying to
pull up.
Populate now, and it is. I can see it, Kathy.
You can see it? Perfect.
Yes.
Okay, great.
Do you want to make it full screen, Kathy?
Yeah, let me get down here and see if this helps. Does that help?
There you go.
Perfect.
Got it? All right, great.
That's it.
Okay, let's get started here. So I'm excited to tell you all we do have a lot of, well, not a lot, but a few new things for 2026 just to prepare you all for 1/1 effective dates. Wanted to let you all know that quoting for 1/1 should be available around Friday or Monday. We usually allow that 90 days out, so Cornerstone should be able to start quoting for you all for 1/1 around that time frame. So let's get started here. So on the agenda today, we had our introduction. I'm going to go over some legislative updates. I'm going to go over some Kentucky small group new products and medical benefits and cost share changes, Carolina RX updates. We're going to go over our well-being solutions within our small group packages. We're going to just kind of go over a little reminder on our Anthem Balanced Funding plans, and then Lisa will go over things to remember, and then we'll do Q&A. So just to show you a little quick snapshot of our team, Harry Hayes is the Director of Small Group and Individual Sales, and of course I am the account exec. I handle new sales 2 to 50, and then Lisa Wilson handles existing business renewals 2 to 50. We also have a Connect team, which handles our experts, I should say, for dental and vision. And Cheryl Olson usually works with the new business, and Yvette Betters usually handles existing. So let's get into the legislative updates. So some of the legislative updates for 2026. There is something called the No Surprise Act. That's out-of-network non-emergency ambulance limit. So within our certificates, and you will see it listed actually on the summary of benefits, any plans that had included the $50,000 limit for air ambulance services will be removed. We will still have the limit, though, for ground and water. But the $50,000 limit for air ambulance will be removed. Another one is, these are just contract language updates. The federal mental health parity updates for payment of therapy services. So if someone is diagnosed with mental health or substance abuse and they need therapy visits, it is going to fall under the mental health and substance abuse disorder benefits. Also, we already do this, the preventive care for chronic conditions, we already cover that. But in our evidence of coverage language, we will be updating to list the chart of items allowed by the IRS for pre-deductible coverage, instead of you having to go to an IRS website that unfortunately is sometimes out of date. Collateral cancer screenings, we've already been covering this the way we should, but we are going to update our contract language to reflect routine collateral colorectal cancer exams and related lab tests will be covered under preventive care. We also are expanding the breast and cervical cancer screenings as of 1/1/2026. So someone having going in for breast cancer screening or cervical screening, things like MRI, ultrasounds, biopsies, things like that will fall under the preventive guidelines and be covered in full. As you all know, the limits for out-of-pocket usually go up every year. This is no different than prior years, but for our non-HSA plans, for ACA embedded maximum out-of-pocket limits, 2025 for individual was $9,200. It's going to go up to $10,600. Our HSA plans are going to go from $8,300 up to $8,500. We also have the IRS guidelines for HSA qualified plans. So the minimum deductible for embedded HSAs is currently $3,300. It's going up to $3,400. And then our non-embedded HSAs are currently $1,650, and the minimum deductible is going up to $1,700. So let's get into some of the new products for 2026 with Anthem of Kentucky. So we have two new features, products for 2026. We're calling these alternative health plans. So the first one is the Virtual Access Plus. That's also known as our copay centric plans. So in 2025, we did offer some plans called copay centric plans. These are plans that have a deductible and then a copay. So they were, more visible to the consumer to kind of see what they would be paying out of pocket. We created those, and we are going to keep those for 2026, but we are changing the name to Virtual Access Plus. So those are not really brand new, but we really didn't get a lot of traction last year. So we're hoping maybe this year we will. But just know that the copay centric plans that we had in 2025 are now going to be called Virtual Access Plus in 2026. We are putting a new plan in called Clear Choice. This plan is an all copayment plan. So if you are familiar with the Surest United Healthcare plans, this will be something comparable to their plan. The difference between our Virtual Access Plus plans and our Clear Choice plans, our Virtual Access Plus plans, we will be offering it on both networks. So we'll be offering on the Blue Access PPO. We'll also offer it on the Pathway HMO. The Clear Choice plan will just be offered on the Blue Access PPO plan. On the Virtual Access plans, it's a copay, then deductible, then copay. On our Clear Choice plans, there is no deductible, so everything is a copayment. Also, on our Clear Choice plans, we will use the Blue Access PPO network, but we also will have a tiering provider network called a Diamond provider. So if members decide to use a provider that is considered a Diamond provider, then they will pay less for a PCP and specialist versus using another provider within our Blue Access PPO network. And I'll show you a snapshot of those plans and kind of what I mean by that. But they do have the option to be able to shop for a Diamond provider and pay less out of pocket. Also on our Clear Choice plan, on all our plans, we offer a preventive RX list where there are a list of preventive drugs that are covered in full. On our Clear Choice plans, we will have something called a Preventive RX Plus list. This is going to be a more extensive list than the Preventive RX list. Some of the drugs on there are GLP-1s, but keep in mind that, they do have to be, the GLP-1 prescriptions have to be due to medical necessity for like diabetes, or the provider feels that the member needs a GLP-1. And then also on the Clear Choice, there is 0 virtual office visit copay for mental health visits. That's not the case on the Virtual Access Plus. And then on our wellness packages, so we do offer the Engagement 200 package in all our plans, and I'll show you a snapshot of that in a minute also. But on the Clear Choice, we're offering the Engagement Package 500. So basically, it's going to be the same program. They're just going to be allowed to earn up to $500 in rewards versus $200. So this is showing you our Clear Choice plans. We are offering 3 plans for 2026. It will be offered on our ACA, our MEWA, and our Anthem Balance Funding platform. Again, it's just the Blue Access PPO network. The first plan is a $3,600 out-of-pocket. As I said, no deductible. And the designated PCP and designated specialist, that's where you would utilize your diamond providers if they would like. So if they use a diamond provider, they're going to pay $10 for a PCP. If they use just a non-diamond provider within our Blue Access network, they would pay $20. Same on the specialist, they pay $30 if they use a diamond, and they'd pay $40 if they did not use a diamond. Also, the urgent care visits are $20, and our emergency room is $30. I did want to point out, because we've just been kind of comparing our plans to Shura's plans. So if you are familiar with the Shura's plans and you're used to selling those, just keep in mind that our plans do not really they don't have a range of costs depending on the provider. So our understanding with the Shura's plan is they have a range of costs. Let's just say from, if they use a designated provider, it could be between $10 and $130, depending on what provider they choose within that designated area, where ours is just going to be $10. So the employee and the members are going to know exactly what they're going to pay if they use a diamond provider. So as long as they're a diamond provider, they pay the lower cost PCP and specialist. And I'll kind of show you, talk about that, how they can find those providers within our Sydney app. And then also seems to be that our urgent care and our ER copays are a little lower too. So just keep that in mind. We also are going to offer an $8,300 out-of-pocket. And then we will have a $10,150 out-of-pocket. So again, there will be 3 Clear Choice benefits available on all 3 platforms. So if a member decides that they are going to take either our Virtual Access Plus plans or our Clear Choice plans, they are going to get a simplified digital experience through the Sydney app. So all our members have access to the Sydney app, which is a great feature to have. But with the Virtual Access Plus and the Clear Choice members, we're trying to make it a little bit more streamlined for them. So when they log into the Sydney app, they will see these tiles and they can go directly to look at claims. They can look at your Find Care providers to search for a diamond provider or just a Blue Access PPO provider. They also can check on their wellness engagement rewards and then any prescriptions. So it's basically just streamlining this feature for them to get to their resources quicker. So employee assistance program. So for 2026, Anthem has decided to embed the employee assistance program into our medical plans, which will give members and their dependents 3 face-to-face visits, either virtually or face-to-face, It also gives them access to legal and financial work-life resources. It helps with behavioral health support. And this will be embedded in all new business effective 1/1/2026, and then upon renewal on any existing Anthem small group plans. So it is available and it will be embedded in our ACA, our Anthem Balanced Funding plans, and our MEWA plans. And then at renewal, if any groups that you currently have with Anthem that have an EAP Basic or an EAP Enhanced program now that's paying separately for that program, it will be migrated to the embedded plan at renewal. So you would no longer have a separate cost for the EAP. It will be in the cost will be embedded in the small group plans, and then Lisa will work with Cornerstone to make sure that they're aware of any groups that might have an EAP program currently with us and help them transition to the new embedded plan at renewal time. So let's talk about some medical benefits and cost share changes within our small group portfolio already. So as I mentioned, the Virtual Access Plus name is going to be, or the copay centric plans name is changing to Virtual Access Plus. So we're just changing the name of the copay centric plans that we currently have to Virtual Access Plus. So when you see our plan grids and you see our quotes, you will see that new name. Also, the flat Tier 4 copayment on the copay-centric Virtual Access Plus plans. So on the Virtual Access plans and the copay-centric plans, the copayment for the 4-tier is going from 25% up to $400 max per script to a flat $400 copayment. So the 4-tier drug will be a flat $400 copayment for those two programs. As I had stated, the Employee Assistance Program will be embedded in all our small group plans. Keep in mind that these visits are also for employees that might not be on the Anthem plan or dependents that are not on the Anthem plan. It is open to all employees and their dependents within that employer company. They do not have to be an Anthem member. Also, the engagement package on our new Clear Choice plans, that will be a $500 wellness engagement program versus the $200 that we have on our other plans. The RX Plus on new Clear Choice plans, that is the more extensive preventive RX list that is only going to be offered on the Clear Choice plan. And then more benefits will be covered at an inclusive copayment. So an office visit, urgent care services that are including lab, x-rays, allergy injections, in-office surgeries, diagnostic tests, things like that will be one primary care copay or specialist or urgent care copay taken per provider per visit. The HSA plans will be more enhanced. So the benefits that include RX infusion, wigs, durable medical equipment, prosthetics, hearing aids. Currently, it's covered under a co-insurance. In 2026, it will be a deductible and then a flat copayment. There's something called the Safe Harbor virtual visits on HSA plans. This is only on our Anthem Balanced Funding and MEWA plans at this time. We did not file it in time for our ACA product, unfortunately, so this benefit will not be in our HSA plans until 1/1/2027. But what this means is that on HSA plans, the deductible is waived for virtual care visits through the Live Health Online. So currently, to have a virtual visit, they had to pay their deductible first, and then it would be covered in full. In 2026, if they use our virtual care only visits through Live Health Online, and it's an Anthem Balanced Funding or a MEWA HSA plan, that will be covered in full. So some of our small group plans for 2026 that are not Medicare Part D credible, Our ACA plans are going to be our $8,000 deductible plans. There are 2 plans on both platforms. So one is an $8,000 deductible with a $9,000 out of pocket, and that's on the PPO and the HMO. And then there's an $8,000 deductible and an $8,000 out of pocket on the PPO and the HMO, and that's on the HSA platform. On our Kentucky Chamber Advantage MEWA plans, all the plans are credible. And then our Anthem Balance Funding plans, there is an $8,000 deductible with an $8,000 out of pocket. That's an HSA, and that is on both the PPO and HMO platform. So let's talk about Carelon RX. As you know, Anthem really tries hard to help make these plans affordable. They try to make the experience streamlined for our members and simple. And I'm just going to kind of talk about some of the features that we have had in our program, in our small group plans that maybe you all have forgotten about, or maybe we haven't talked about enough, to just kind of remind you some of the great features that are within our small group portfolio. So one of them is the Preventive RX list. As I mentioned, all of our plans have a Preventive RX list. It's a list of drugs. Some are brand, most are generic, that are covered at 100%, no cost share to the member. On the Clear Choice plan, keep in mind that that's going to have the Preventive RX Plus list, which is going to be a more extensive drug list and includes some of those GLP-1 drugs. We have also a program called EnsureRx. You probably have not heard this name, even though this benefit has been in the small group plans. We just haven't promoted the name. You'll probably see more marketing pieces with EnsureRx on them. But this program is a member savings program that compares the benefit cost for over 200 covered generic medications. So this is the kind of the way it works. And it's very seamless to the members, which makes it even just a greater feature for our members. So all they have to do is, when a member requires a prescription, they present it at the pharmacy. The pharmacy will compare pricing across multiple discount cards, and then they will charge the member the lowest price available. So they're going to check all the discount cards for them and charge them the lowest price. If it is a covered drug, it will apply to the deductible. If it is and they will check non-covered drugs too, but if it is a non-covered drug, of course, it will not apply to any deductibles. But it's a great feature that I think people don't realize that we have, because it is seamless. We automatically do this for our members once they go to the pharmacy with the prescription. So let's talk about our well-being solutions. So our small group plans, our ACA, our MEWA, our Anthem Balance Funding PPO plans, they offer the fully insured foundational package. They also offer the Kentucky Engagement Package 200, which is all these features are included in our small group plans. They have something called the Smart Shopper that I'll talk about in just a minute. And then we're adding new for 2026, the Employer Assistance Program that will be embedded in all our small group plans. On the Clear Choice plans, it has the foundational package, it has the Engagement 500, and then it'll also have the Smart Shopper and the EAP program embedded. So this is a snapshot of our foundational package that is in all our plans. No extra cost to the members. Nothing is changing on this between 2025 and 2026. These are the programs that are the 24/7 nurse line, diabetes prevention outreach. They have condition care, complex care, lots and lots of programs to help people stay healthy and stay on track. This is our engagement package 200 and our engagement package 500. So this is where members can earn digital gift cards, either MasterCard, Amazon, Target, Home Depot, all kinds of digital gift cards that they can earn by just doing their wellness programs, doing their wellness things. So like an adult wellness exam, if they have a physical once a year, they can earn $25 gift card. And if it's an engagement 500, it would be it would be $30. One thing that is new for 2026, in 2025, we only allowed members to get their wellness exam within 90 days of their effective date so that they could earn that gift card. We are now allowing them 120 days to get that adult physical done as of their effective date so that they can earn that reward. Another thing we're adding is a lot of diabetes programs. A1C lab test has been added. There's also diabetic foot exams. Something else that is new is if you select a PCP in the Sydney app, not that we require that for our HMO programs, but if they do select one, they can earn $10 on the engagement 200. And then if it's the engagement 500, it would be $20. We also added log daily nutrition. They can do that quarterly and earn $3 per quarter on the $200 program. And they can earn $10 per quarter on the $500 program. So the engagement 200 is in all our plans. The engagement 500 is only in the Clear Choice plan. And they can track and redeem their gift cards through their Sydney app. Smart Shopper is another feature that we offer in all our small group plans. This is a program that allows members to easily check pricing for 50 plus common procedures. It's very, again, streamlined and very easy for the member. Basically, all they have to do, if they get recommended by their doctor to have a medical test or procedure done, they can go to smartshopper.com and they can shop prices. And then, or if they don't want to shop online, they can contact our concierge care team member and they will direct them to some of our cost-effective providers to have these procedures done. They go to the reward eligible location to have the procedure done. Once the claim comes into Anthem, then we send them a reward in the mail. Very simple to use. It's not, they aren't forced to use a more cost-effective facility, but if they do, they're going to get rewarded for it, and it will help them out-of-pocket cost also. Anthem Balanced Funding. So that's a new program that is starting to get a lot of traction with Anthem right now. This is offered to groups with 10 or more enrolled employees. We will quote this for groups that are currently on a level funded plan, or if they're not on a level funded plan. I think when we first wrote it out, we only were quoting for level funded, existing level funded, but that's not the case anymore. So we will quote for both, whether they are on a level funded plan or not. And the great thing about this program, it looks and feels just like a fully insured plan. So the premiums are the same each month. They're not going to change. And so everybody knows, what they're going to pay. I guess the only plus about this is that if the claims run well throughout the year, then the employer could earn up to a 50% surplus at the end of the year. If they don't earn it, it's not going to affect them in any way. They would just renew and move on, but it doesn't affect the rates or anything like that. Another thing that you all may not be aware of is some of the groups with the Anthem Balanced Funding potentially could earn a transition credit. That is a credit that we would give on the first month's bill. So it is, up to underwriting's discretion on whether the group qualifies for this or not. So I would ask, Cornerstone would reach out to us. If they quoted an Anthem Balanced Funding plan for you, they would reach out to me if it's new business, and I could tell them if your group qualified for a transition credit. And over to the right's just showing if it's a group of 10 or 20, they could earn $2,000, up to a group of 41 to 50 could earn a $6,000 credit. So this is a good feature too to help, especially help groups that maybe might be level funded currently and might have gotten a surplus and they're on the fence about moving to another carrier. This might help offset that surplus that they may have gotten. And now I am going to turn this over to Lisa, and she's just going to go over a few things, a few reminders for everybody. Lisa?
Great job, Kathy, and thank you so much. Yes, you can go to the next slide. We all, there you go. Thank you, Kathy. We all know that we have a new year approaching us, and I just wanted to touch on a few reminders about your existing business and new business. So this slide here is just a reminder, and it's going over our bundling discounts. When a group add new dental and vision together, the group will receive 5% off of that dental rate, and they'll also receive 5% off of that vision rate. So not only will they get that bundling discount of 5% off the dental and vision rate, they will also get 2% off the medical premium. And I'm going to speak a little bit about that on the next couple of slides. So again, they will get 2% off if we're adding dental and vision. This slide here, the first bullet I wanted to point out, for new groups 10 or more enrolled, Kathy talked a little bit about the Anthem Balanced Funding product. So groups with 10 or more enrolled, we ask, and if they're currently on a level funded plan today with another carrier, we ask that you quote our ABF first, our Anthem Balanced product first. And then if the group does not have a current level funded, so if they're coming from another carrier and they're not currently on a level funded, we ask that you always quote our Chamber Advantage, which is our MEWA plan first. Now, on that slide prior, I talked about the 2% discount on the medical premium if the group add dental and vision. I definitely want to call this out. On our ABF plans, you get the 2% off the medical premium no matter what when they add dental and vision. But that 2% is off the medical premium itself. So just say a group have a medical premium of $5,000, you can actually do the math on this one. You can take 2% off of that 5,000, and that is going to be the rate if the group add dental and vision. On the other hand, on the third bullet, if a MEWA, which is a Chamber Advantage, if that group add dental and vision, they will receive 2% off the medical risk factor. And that calculation is a little different, and we get a lot of confusion around that, but I definitely wanted to call it out. So when a group on a MEWA plan add dental and vision, we send that back to the underwriter. They get the discount and then they send that back out, but that's actually on the medical risk factor. Really close. It could be within cents, but it is a little difference, and I wanted to call that out. And then starting January the 1st, you probably have already seen this happening, but the commission, we had an increase in our commission for both the Anthem Balanced Funding product and our Chamber Advantage product. It went from $28 to $35. So that's some good news that we wanted to share with you. And then on any existing business, you're going to get that change at the group's renewal. And then the last bullet on this page, effective January 1st, some of you may already know this as well, the Lexington Clinic joined our Pathway HMO product network and also the individual and small group, or for the individual and small group. Next slide. Thank you. Couple other reminders. I definitely wanted to call out the first one on our voluntary products for our ancillary. Many times we get questions about voluntary dental and vision. Well, our dental and vision are rated on the group's meeting participation and not the employer contribution. So as long as the group is meeting 50% net eligible and has at least 2 people enrolling or 2 members enrolling on the plan, they can purchase an employer sponsored plan. And many times, or most of the times, those rates are cheaper with no waiting period. So I would not quote or ask a voluntary if they meet that participation, because the rates are better and they don't have a waiting period on our employer-sponsored plans. The next bullet is the open enrollment rule for our legacy business. We know that we still have a few groups, and the majority of those groups are on a January renewal. In legacy, we also hear grandmother groups. We have a little bit, right at about 8,000 members still on that grandmother block. And the majority of those renewals will be coming out closer to the end of October. But what I do want to remind you of, we get a lot of confusion and a lot of questions around this. Upcoming grandmother legacy renewals, January 1st, the open enrollment for our legacy plans only. This is only for our legacy grandmother groups. The open enrollment is 30 days before and 30 days after. However, if an employee application come in for enrollment after January the 1st, their effective date will be February the 1st. So it's the 1st of the following month. Anything that comes in before January the 1st, they will be enrolled for the 1/1 effective date. Now, again, this only applies to our grandmother block, our MEWA, ACA. It's still 30 days before, 30 days after, and we retro enroll those members. Only our grandmother block, we do not do that. AOR guidelines. You guys are well aware of this, but it's just, again, another reminder. When AORs are submitted, they are effective the 1st of the month following 30 days. So when you submit an AOR letter, a lot of times I get calls, hey, I can't see that out on the broker portal. Well, you will not be able to see it until the AOR is effective, and that is the 1st of the month following 30 days. While I can work with you, or Tracy, we can work to get that information for you. But I just can't, you won't be able to receive any commission, or you won't be able to see it on the broker portal until that date. I do want to call out ABF quoting for existing business. While we can quote ABF for new business if they are currently on a level funded today, on existing business with Anthem Balance funding, we do require 10 plus enrolled. So if you have an existing group with us today and they have 10 or more enrolled, we have to have a competitive level funded quote first. You would send that over to your Cornerstone rep. They will send it to me. I will have to send that information over to my underwriter for approval. Once approved, I will go out and run that Anthem Balance quote for you, and I'll share that with your Cornerstone rep, and in return, they will send that over to you. So those are the steps for existing business. And then this last bullet on here is the MEWA. I always love to go over this little part here as a reminder. MEWA groups that are written in January, they will receive a renewal date of 6/1. So if you have a group that you write in our Chamber Advantage block, January through June, they'll receive a 6/1 renewal date. And then if you write anything after June, anything July through December, they will receive an October renewal date. But I wanted to remind you, those groups that you write in January, they will have a 17-month rate guarantee. So that's that long contract. Well, they ask about an open enrollment. Their first open enrollment, when you write that group January the 1st, 2026, they will have their first open enrollment June 1st, 2026. So, and it's nothing noted anywhere out there, but it's a reminder. And Kathy, if you can share the next slide, I can kind of point that out. This slide, I'm not sure if you can see it or well, but we do have this document I can share with the Cornerstone rep. They can share this. This is being updated with our 2026 and 2027 year. But if you look towards the middle of the screen, you'll see the January 1st, 2026. That group has a 17-month rate guarantee. If you scroll all the way over to the right, you see their first open enrollment will be 6/1/2026. And then from there, their following will be 12 months after that. So every June. But I just wanted to call that out because that's like a 6-month time frame. They will be in open enrollment. So that wraps it up for me, guys. So we are now going to open it up for questions, and I'm going to turn it back over to Tracy.
I do have a couple. Kathy, can you speak to how those diamond providers are designated in the provider lookup?
Yes, they will not. So if you go to the Anthem site now and you go to the Blue Access PPO network, you will not unfortunately see them. So my understanding is currently, if you hadn't purchased the plan yet, if you're not a member of the plan yet for Clear Choice, you will not see those out there. Once you become a member, you can find those on the Sydney app. They will be, I haven't seen if there's like a little diamond icon, or if it actually says diamond. I'll find out that for sure for you all. But I do know currently you have to be a member of Clear Choice to search for the diamond providers. And you can search for them through the Sydney app. As I showed you, it's very simplified for the Clear Choice member to just click that Find Care a button. You'll go to the Blue Access PPO network, and you should be able to see a list of diamond providers there. Also, you can go to the Anthem website and find them under the Blue Access Care. But again, it's not, it's only if you're a member. Now, I did, Tracy, just send an email out to you all with all the updates for 2026 that I had just mentioned. There is a link in there that you can send out to your brokers if you'd like, where they can search the diamond providers through that route without being a member.
Perfect. Okay. And then on the ABF plan, if a group qualifies for a surplus, how is that surplus returned to the group? Is it a credit on their invoice, or do they get an actual check?
It's a credit on their invoice.
Okay.
And if they term, they do not get the surplus. So if they stay with us, they'll get the credit on their invoice the next plan year. If they leave Anthem, then they forfeit that surplus.
Okay. And then on the bundling discount for the MEWA product, am I correct that it's not an automatic, those groups actually have to qualify for that? So we would need to talk to you or Lisa to determine if a group would be eligible for that discount.
That is correct. Yeah.
Okay.
Go ahead. You want to
No,
answer
I was
it?
gonna, you go ahead.
Okay, well, that is correct. First of all, I want to tell you on the Anthem Balance Funding plans, all groups get the 2% off if they purchase the dental and vision with the medical. That is a guarantee on the ABF. On the MEWAs, that is true, Tracy. If the group was rated with the lowest rate factor, and you all will not know that because in Kentucky we do not release rate factors, but Tracy, you can come to myself or Lisa. Then we can't go any lower than that lowest rate factor. So they would not qualify for the 2% off the risk factor. But if they aren't the lowest, then they should qualify for that 2%.
Perfect.
And just to add to that, Tracy, that's the same for existing business. Yes, if you will reach out to us, and I can let you know which group qualify for that 2% if they're adding ancillary on at renewal, and which groups do not.
Okay, wonderful. And I think that's it. I don't see any other questions in the box. So we do appreciate your time today. A lot of good information. And again, if anybody on the phone should have any questions after the meeting, please reach out to your Cornerstone account manager and we will be happy to help you.
Thank
Great.
you.
Well,
Have a great day.
Great. Thank you.
Bye, everybody.